which one is weak?
Lateral rectus.
You're on the right track. People are saying medial rectus and lateral rectus. But which one is the weak one? Which one needs to bring it this way so it's more straight? Remember, muscles shorten. Lateral rectus. Okay? So, the way you fix this is you give them, make them say, like, you know, like kids, it's really nice because you say, oh, I'm going to make you turn into a pirate because you're going to put an eye patch on one eye. Which eye do you put the eye patch on to train the eye to move, you know, to train that muscle to move in the proper way? Do you put the eye patch on the good eye or do you put the eye patch on the bad eye? The good eye. So that's, you put, if this is my situation with here, I'm going to put the eye patch here. Now it's going to force my eye to look straight. So my lateral rectus is going to train, you know, to exercise, to get stronger. Okay? And you do that for a few months and hopefully it works. If not, then you're going to have to do some surgery. And surgery is a pretty, I wouldn't say simple surgery, but in theory, it's very simple. What they're going to do is, if this is a lateral rectus, we're going to remove a portion of the muscle and then tie it together. So we're making the muscle short to bring it that way. Okay? Make sense? All right? All right, a03 palsy. You ask the person to look, and he has ptosis, right? He's got one eye that's drooping. You ask him to look to his left, and you're going to open up the eye because he can't lift it up. This eye is going to stay straight because he can't move it that way because cranial nerve 3 is affected. Even if you shine light, because cranial nerve 3 deals with the pupillary reflex, when you shine light on the eye, it should constrict. But if it doesn't constrict, you know that it's all coming together. You know what I'm saying? You're having the eyeball that the eyelid can't open. You can't move the eye medially. You can't make the pupil constrict. You put that all together, there's a common denominator. Cranial nerve 3 does all this. Okay? Cranial 4 palsy. I'm asking the person to look in that direction, where the desk is. And on his left eye, he's doing that. But his right eye, technically the right eye would move down to the tip of his nose in order to see the desk. Does that make sense? But he can't do that. It's just moving that way, but it's not looking down and medially like that. You see what I'm saying? That's cranial nerve 4 palsy. All right, and everything that I just explained is right here. Cranial nerve 6 palsy is that we're going to ask the person to look to the right. He looks to the right, and the left eye does look that way. But the left eye is, because the eye is looking medially, that's cranial nerve 3. But the right eye over here can't move that way. The lateral rectus of the right eye is not moving. And what controls the lateral rectus? Cranial nerve 6. Okay? Questions on that? All right. I wouldn't go into this until you understand what the cranial nerves do. Okay? So some abnormal findings. Conjunctivitis, pink eye, all right? And this is the most common eye disease that we see here. And it could be due to bacteria, viruses, foreign bodies, allergies, and you can see the whole conjunctiva being red there, okay? Scleroicterus, that means that the sclera becomes yellow. And you can see that over here. This is usually a sign of liver disease, even pancreas disease, okay? And their skin turns that color too. It's what we call jaundice, right? So a lot of bilirubin is not being broken down by the liver, so it has no place to go. It goes in your skin, goes in other places like your sclera and stuff. Okay? Pale conjunctiva, you can see this with black people a little bit easier, but I can see it in white people too. When you bring this down, you can see the conjunctiva. If it looks pale, then there's a good chance that person is anemic. Okay? Corneal abrasion, something goes into your eye, like a sand grain in the wind when you're on the beach, and you go and you rub your eye, you're going to abrase it. You're going to scratch your cornea. And you have corneal scarring, and that, they would have to remove the cornea and put a new one there. It's that bad. Cataract, all right? The lens is supposed to be clear, but it's tissue there as much as anything else that I explained to you. If the lens gets cloudy, there's molecules in there. If they start clumping together in it, you're not going to be able to get that light to come in because it becomes very cloudy. They get a blurry vision, faded colors. When they look at stuff, areas that have light, let's say lighted areas, you get this typical yellow glow around those lighted areas. I'll show you a picture of what I mean by that. And this is just some medications can cause this. Diabetes can cause this. Smoking, sun exposure, eye trauma, aging. Just as we get older, you probably know, like grandma and mom or dad, they're getting cataracts. It's just one of these things that we look forward to when we get older. So what happens here, the light normally is supposed to go right through that clear lens, and you can put a nice picture on the retina. But if the lens becomes cloudy, it blurs, and you're not going to get a good focus of what you're seeing. All right? So sometimes the cataracts are pretty obvious. You can look in people's eyes and see what it's like this white area. And this is what they'll tend to complain of. This is what you usually see without cataracts. You're looking at flowers up there, and you see a lighted area here. But if you have cataracts, it'll appear like this. See how there's like this yellow glow and this blurriness going on. And that's where you can talk to grandma and say, Grandma, you sure you're seeing okay? Oh yeah, I see pretty yellow lights around things. I'm like, Grandma, you sure? Well, things are blurry. You're putting things together. I'm not trying to help you diagnose things, but you have an idea what's going on and say, Grandma, let's go see the doctor. All right, it's something that can be fixed. Okay? Retinopathy. This is basically diseases of the retina. Like I said, you could look at the retina and see the blood vessels coming out. So here you can look at different things. Now, I'm not going to ask you about all these different things, silver nicking and all this kind of stuff, or silver wiring. But what happens here is you're looking at the blood vessels, and if they're engorged with blood, there's going to be a high pressure there. All right? They have something we call this silver wiring. If the blood pressure gets so high, then the fluid is going to leak out of the blood vessels and go out into the eyeball itself. We call that papilledema. Edema is this extra fluid that's coming out. That's the blood pressure so darn high that it just leaks out. Bad sign. So if I see that in someone's eye, I could bet there's things happening all over. I can't see the blood vessels in the heart. I can't see the blood vessels in the brain. But if I'm seeing this, I'm getting an idea we got to do something because this is the tip of the iceberg, right? Okay? So you get ischemia first, which is a decrease of oxygen going there. You'll get the optic disc edema, and that can actually cause what we call retinal detachment, which is a surgical emergency. That retina is coming off the back of your eye, which means if that's all your nerves, you're going to go blind. Okay? So what happens here is, what they'll see is here's the optic disc, and here's the blood vessels. You'll see this silver wiring. It's better to see on the screen, but what you're doing is if you have a ball like this, it looks like a circle, but to make it look like a ball, I'm going to do this, I don't know, reflection like thing. Now it looks like a sphere because you get the image that this is bulging out. Same thing here. You should normally see blood vessels like this in the eye. But when you start seeing a white line over here, it's starting to be bulging out. Does that make sense? Kind of like what this reflection's doing. So when we see that, and that's called silver wiring, it looks like a silver line, like a wire going through the blood vessel. When we see that, that's saying that there's so much blood in there, blood pressure, that is bulging out of the screen. And that's what that is, okay? Again, I won't ask you about all these different things about here. Just understand, looking at the back of the eye and looking at blood vessels, you get an idea of what's going on in the person's body, okay? And you can see hemorrhages and exudates. It gives you an idea, okay? Papilledema, as I said before, it's increased intracranial pressure that can happen, and that can cause glaucoma too, okay? The retina detachment, as I mentioned before, is a surgical emergency, all right? The person will go blind if they don't go and fix that now, and they'll do that like 3 o'clock in the morning, okay? Macular degeneration, as I talked about before, that's the most focal area of looking at things, the highest acuity. And when that starts degenerating, this is what they end up seeing, is black spotches around here, okay? Basically, the last thing I want to do is just talk about, pretty common, I see a lot of people wearing glasses now. This is what it's all about, something called nearsightedness and farsightedness, or myopia, or something called hyperopia. This is what's happening. In nearsightedness, this means that you can only see things clear when things are up close. Nearsightedness. I can see things near, no problem. All right? I have problems seeing far things. That's what myopia is. And the reason why this is because the eyeball is longer than usual. Okay? And I'll show you pictures of it. When the eyeball is longer, then what happens here is the image comes in, the focus would be in front of the retina. By the time it gets to the back of the retina, it's already blurry because the eyeball is longer. So the lens doesn't change. So the image is going, it has to be the same distance. The image to be focused is, let's say, I'm just giving numbers, let's say 10 millimeters. But if the eyeball is longer, it's still 10 millimeters, but now from the lens to the retina is now, let's say, 14 millimeters. So it's not going to be focused because it focuses in front of the retina. Does that make sense? Okay? So to correct this is that we can't really change the lens, we can't change the eyeball, but we could put something in front here, anterior to the lens. We could put another lens here, and that will correct this. How long the eyeball is depends on, how thick the lens is that you got to put here depends on how long the eyeball is. And the optometrist will figure that out. Now, the lens you got to put here is going to be a concave lens. All right? So let me show you what this looks like. Okay? The dotted line is what the image is supposed to do. The dotted line comes in here and it's going to put the image right on the retina, where it's supposed to be. But if someone who's got myopia, where the eyeball is longer than usual, and it's not drawn to scale here, then the image is going, the image is going to be focused in front of the retina. So by the time it gets up on the retina, it's already blurry. But if we put a concave lens here, meaning it's concave on this side and concave on that side, and many of you have glasses, and if you know your nearsightedness, it's so subtle you can't see this concave unless your eyesight is extremely bad, where your eyes are they got really thick lenses. But right now I don't see anybody with that. But you would see it then. But it's so subtle you can't see it. You have this concave lens. This is going to correct the image to be put on the retina. Does that make sense? Okay? So myopia is nearsightedness. I can see things close up better than far distances. The eyeball is longer than normal, and the light rays focus in front of the retina. What you correct is wearing eyeglasses that are concave. Now let's look at hyperopia. This is farsightedness. If you understand myopia, this is just the opposite. Farsightedness means I can see things in the distance much better than things like reading a book. In this case, the eyeball is shorter than what normal would be. Okay? And the light rays would focus in back of the retina. So in this picture here, the eyeball is shortened. So now the image would be focused behind the retina. So as it passes onto the retina, it's not focused yet. But it never will get focused because you don't have retina back here. So now when it gets on the retina, cones and rods pick that up and it's going to be blurry. So to correct that, we will use convex lenses. So let me show you what that looks like. All right. Normally, the dotted line is what's going to be seeing things in a far distance, and it will focus right onto the retina. But because the eyeball is shorter, someone who's got hyperopia, what will happen is the image will go past right through the retina and focus back here. So on the retina, it's not focused. To correct it, you wear a convex lens. And again, you can't see this, but you know, on your glasses, because you have to have it really bad. But what this is going to do is correct it with the lens that you have over here, and it's going to position the image right on your retina. Okay? So again, hyperopia means that you can see things in the distance much clearer than reading a book. And this is because the eyeball is shorter than usual. And the image, if it's going to be focused, it's going to happen behind or posterior to the retina. The way to correct this is convex glasses, eyeglasses. Okay? Not too bad?
In normal vision, light passes through the cornea and then through the pupil, which is actually a hole in the colored part of the eye. It continues to travel through the lens and focuses the image onto the back layer of your eye called the retina. At this point, the image is converted to electrical signals that are sent to your brain. A person who is nearsighted sees nearby objects clearly, but light rays from distant objects focus in front of the retina, making distant objects blurred. A farsighted person sees faraway objects clearly, and the rays from nearby objects focus behind the retina and causes similar blurred vision. Near or farsightedness can be attributed to a combination of factors: the curvature of your cornea, the shape of your eyeball, and the condition of your lens. In normal vision, light first enters the eye through the cornea. The cornea is smooth and round, then through the pupil, and then the lens. As light enters the eye, it focuses at a single point on the retina at the back of the eye. LASIK surgery is for people who are nearsighted. That's where distant objects are blurry because the images are focused in front of the retina instead of on it. LASIK surgery uses a laser and a cutting tool called a microkeratome to form a flap on the cornea. The corneal layer is flipped back and the inner layers of the cornea are treated with the laser. The laser will change the shape of the cornea so the images entering the eye will strike the retina more directly and help sharpen your vision.
All right? Just a couple of things really fast. Xanthomas. You will see these patches of yellow in the eye area over here, in the eyelids. This is saying that this person has so much cholesterol in their body, it's seeping out into your skin. Why it happens in the eye, I don't know. Maybe it's because it's just thinner over there. I'm not too sure. But we could see that. Someone's not taking their medication, not seeing the doctor. And I've actually diagnosed quite a few people with that. Okay? It usually happens in both eyes, not just one eye. Okay? Exophthalmos, the eyeball is bulging out. When we get into endocrinology, we'll talk about this. You ever hear of Graves' disease or hyperthyroidism? They have this bulging of the eyes. And what happens here is that the bulging eyes have that scared look. I mean, when you look at everybody right now, you can see the sclera is underneath the iris, and that's normal. But you shouldn't see sclera at rest above the iris. That's what's happening. You see the sclera above the iris. But at rest, you shouldn't see that. That's telling us that the eyeball is bulging out. And in Graves' disease, you'll learn a little bit about that. If it's on one side, then it's probably some tumor that's pressing on that one side. If it's both sides, chances are it's going to be like a systemic thing, like Graves' disease, because it's throughout your whole body that's producing these autoantibodies that are probably pushing the eyeball that way. Okay? Color blindness, X-linked genetic diseases, right? We talked about that. If you're lost of X-linked stuff, this is a good time to go and review that. Okay? Because your final exam is coming up. So I would make sure you understand the differences with X-linked. It's more common, obviously, in males, and they have problems with they're missing either the red or green cones. Okay, so you can all see that this says 22, right? See the 22 in there? So that means that you're not colorblind.
It says 22?
Yeah, no, okay, everybody's thinking, no. Should be 70, right?
Yeah.
Okay, 70. You see the green there, it's 70. All right, I did it. We're a few minutes over. Anybody have any questions about that? Okay, look at that over there.